My name is Professor Jamie Hacker Hughes. I'm a consultant clinical psychologist, clinical neuropsychologist, psychotherapist and EMDR consultant. Overall population estimates put it at about 4 to 6%, so 1 in 20 people. In military populations, there are figures showing that that can go up to 10% or 15%, so 1 in 10 or 1 in 6 people. That's a lot of people. The recommended treatments for post-traumatic stress disorders, especially the treatments recommended in the UK by NICE, the National Institute for Health and Care Excellence, are mainly psychological treatments, psychotherapeutic treatments. There is a place for psychiatric treatments and treatments involving medication, but they should be very much a second resort. The main treatments are psychological treatments, notably cognitive behavioural therapy and a treatment known as EMDR, eye movement desensitization and reprocessing. Getting people to reprocess the event and unfreeze the memories that they have frozen, because the brain has different ways of storing horrific sudden memories. My interest in training to treat post-traumatic stress disorder really goes back a long way. It goes back to when I was a very young boy. And my mother was involved in the Aberfan disaster in South Wales. So I had that severe experience of catastrophe at quite a young age. Later on I went to serve in the army and served in areas of conflict. And then I also had personal events such as a very bad road traffic accident on a motorway and a near drowning in Norway. And I'm sure it was the combination of all of those together with my interest in psychology that led me into specialising in understanding and treating trauma. Initially, it's quite normal for anyone who's exposed to trauma to be shocked and dazed and confused for a period of time. It's also quite natural for people to have intrusive thoughts and dreams and nightmares about what's happened. What happens is that generally most people recover from those sorts of incidents. A number go on to develop what we call acute stress disorders, where those symptoms carry on for days or weeks, and the official diagnostic criteria that psychiatrists use talk about anything up to a month after the traumatic event. The child and family practice is fairly unique because it has a combination of psychologists, clinical counselling, health psychologists, psychiatrists, psychotherapists, family therapists, all working together in one practice. So what that means is that people can go to a practice like the child and family practice, have a multi-professional assessment from people who are really well trained and qualified to do that, and then the right sort of treatment depending on what they require.